Good afternoon, everyone, and welcome to the Flint Community Webinar on Coronavirus. This is week 62, May 21st, and we're happy to be here with you. The Flint Community Webinar on Coronavirus is sponsored by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Michigan Prevention Research Center. I'm excited to be your moderator today because we have a great panel of speakers that are going to share some amazing information with you. So excited to be a part of this as a co-director of the Healthy Flint Research Coordinating Center's Community Core. Today, May 21st, we know is still Mental Health Month, Mental Health Awareness, and we're really working to try to reduce the stigma of mental health. So you can help by hashtagging Stop the Stigma. During this month, it's been very exciting that we've had our mental health providers come and talk to us about so many wonderful initiatives that have been happening at the Genesee Health Systems. But I also want to give a shout out to Afton Shavers, who works at the Greater Flint Health Coalition, who works with Recast funding some of these great projects. And as you can see here, we just want to give you a weekly reminder of things that are happening for this week during the balance of this month. Be sure that you look at all the opportunities for you to do some introspection and personal growth, some training opportunities. There's something for everyone every day of the week. Every day of the week. So by the end of this month, the community should be well equipped to know about the resources and honor mental health for them. Honor your own mental health and the mental health of others. We do want you to know that because this month will be ending before we get back, the work around mental health will not end. So continue to stay tuned to what's going on. We also want to remind you that this is Asian American Pacific Islander Heritage Month. We raise this to you because all of our communities are important, and it may be well for you to seek out some information on what is happening in some of the other communities as well. You might even be more connected than you realize. Today is an important day. It is May 21st again, and I'm going to tell you it's important because today is Get Vax. It's a digital action, a call to action by the Department of Health and Human Services that's asking us to ensure that we share the information that we learn because we want to not only protect ourselves, but we want to protect others. Dr. Deborah Verholden is going to come and tell you some more details about this very important day and how you can get involved. Dr.
Yeah,
Deb.
thanks, Yvonne. So it's today, May 21st, Get Vax Digital Day of Action. So what are the action that we're trying to do? We're trying to help people deal with some of these access barriers that they had to vaccines. And there are 3 ways that people have access that they might not know about. So we want you to know them and share them. The first is you can go to www.vaccines.gov. There's a vaccine finder there. You put your zip code in, and it will tell you what places there are around you to get vaccines. And now in most places, you don't even need an appointment. You can just show up. You can also text the word vaccine to the number 438-829. And if you're saying, that doesn't sound like a whole phone number, it's some magical stuff that works now with our cell phones. You put that in as the number, 438-829, put the word vaccine. Really, you can put any word in the body of the text, click send, and it'll pop you back a message and says, click on this button, put in your zip code. And then again, it tells you all the vaccines near you. And it works. I know I tried. Or you can call 1-800-232-0233. And so share these resources with people. If you know people who are having trouble getting a vaccine, still aren't quite sure where to go, maybe say they're still stuck on a wait list, give them that information, put this information up on your social media, and then use the hashtag We Can Do This. That's how they're tracking how much movement we get out of this Get Vax Digital Day of Action.
Thank you, Dr. Deborah. Appreciate that detailed information. And one of the things that is so important to us in this webinar is that we're providing information for you and sharing with you so that you can make an informed decision and help others do the same. So for this last 62 weeks, we've had an array of wonderful community partners that have helped us share information with you. And I trust those of you that are listening by phone, or if you're not able to actually see the slides, that you will take the opportunity to see the number of partners that have joined with us to share this information with you. I want you to know that they are right now behind the scenes ready to answer any questions that you might have as much as we can. You might ask us some tough questions today, but put them in the queue. Our team will be in the background waiting to answer those questions for you. It is so important. We've talked for these last few weeks about all of this information about COVID. We talked about what it was. And today we've learned, well, last week we learned that children now, ages 12 to 15, will be able to get the vaccines. We also today are going to get an update from our governor's office. There's some public policy updates that we're going to talk to you about. And we're going to finalize conversation we started with you last week, getting your input on vaccine administration. So we have a great panel today. We're going to look to hear from Dr. Mona Hanna-Attisha, Dr. Susan Wolford, Dr. Lawrence Reynolds, and Dr. Hacker. We just want to talk to you today about what's going on with these vaccines in children. But before we do that, we're going to give you an update on the input that you provided for us last week. We went through this really quick and we started it early, so we only had 38 persons in the webinar at the time, but we're going to ask you, we're going to do some additional polling. So please come on as early as you can to answer these questions for us. So we asked, how likely are you to get a COVID vaccine? And of the 38 people, 91% said they already had the vaccine. And there was clearly an interest in it. I will get it, 3%. Another said they were undecided. And then we had another said that they would not get it. We asked about influencing factors to get the vaccine. Vaccines will prevent me from getting COVID was one of the statements. Vaccines save lives and vaccines is safe. 18 other persons said yes to safety. 22 said vaccine saves lives, and 23 of you said vaccines will prevent me from getting COVID. What about the influencing factors to not getting the vaccine? And only one person answered that: not enough information, no primary care physician, and a lack of trust. And hopefully during this webinar today, we'll address some of those issues for you. We also asked a question in the next slide that says, how has open access reduced the barriers in vaccine administration in the Flint area? And we're going to talk a little bit more about this later, but 50% of you said yes, a lot. And then 40% said somewhat. So over half of you indicated that this was really important. One said not really, and then 8% said not at all. So we've got to do some more work in that area. A COVID vaccine is available for children ages 12 to 15. This is where the panel is going to be really, really helpful to us today. 5% of you said that they had already received their vaccines. 8% they will be getting the vaccine. And a couple of were undecided. And then we had a few more that says they didn't even have children 12 to 15. So we're going to encourage you today, as you're listening to the panelists speak about this, that if you know family members who have children in this age group, they really want to get this information, because the last question was, are you in favor of children ages 12 to 15 being administered COVID vaccines? And the majority of you, 30% said yes. And there are a few that were still undecided. So we've asked this panel to come today to open this conversation up, to answer some of these important questions for us today. So our panelists, Dr. Susan Wolford. Oh, there's Dr. Mona. Hey, Dr. Mona, good to see you this morning. We also have, is that Dr. EJ? Oh, no, that's not Dr. EJ, but there's Dr. Hackard. And so and Dr. Reynolds, I know Dr. Reynolds is here somewhere. There he is, Dr. Reynolds. So I've got a few questions. I'm going to put these questions out here for you, and I'm going to ask you all just to jump in. Now let's start with you, Dr. Mona, as I ask these questions. But as pediatricians, what do you tell your patients? We know that they're great concerns. Some of the parents, because children can't get the vaccines, their parent or an adult has to do this for them. So we want to know about that, and then talk about the safety of these vaccines. Some of the questions that have come to us is, we know about chicken pox, we know about measles, but this whole quick, rapid thing about getting these vaccines for children, we're not too sure about that. So I just want to start there and help us, Dr. Mona, as you get started, and then others, please chime in. What do we say to individuals who have children that are asked now, especially on today, to get their children vaccinated.
Thank you, Yvonne. And thank you for having me. And kudos to all of you for being on, what is it, like week 500? It is amazing. What you have been doing since the onset of the pandemic has been incredible. So thank you for being this incredibly valuable community resource. So this is what I get to do every day, is talk to kind of parents about the vaccine. And this is what we have been doing as pediatricians forever. We have conversations with families about vaccines, be it the measles or the mumps or the rubella. The list goes on. We give vaccines, and the conversations that we have revolve around several things. It revolves around why it's important. So I want to talk about that first. Like, why is it important to get this age group, the 12 to 15-year-old age group, vaccinated for COVID? Because COVID can hurt this age group. We haven't heard enough about kids getting COVID, and it's a serious thing. I'm going to read you some numbers. About 1.5 million children ages 12 to 17 have gotten COVID. 13,000 children in this age group have been hospitalized. Hundreds of children have died from acute COVID. In Michigan, we've also seen cases in kids. We've seen hospitalization kids, and unfortunately, we've also seen deaths in children. So it is a serious disease in and of itself in children. In kids, we also see some problems that we don't see in adults. A couple of weeks after getting COVID, there's children who develop a rare condition called multi-system inflammatory syndrome in children, also known as MISC. We've had kids in Hurley admitted with this, and they are sick. They are in the ICU, and there's damage to their heart and to their lungs and multiple organ systems. We don't even understand it very much, or why this is happening, why the body begins to attack itself after getting COVID. And these are previously healthy kids who don't even maybe know that they were infected with COVID, and then 2 to 5 weeks later get COVID. So right now in Michigan, as these cases are coming down, pediatricians are on high alert watching for MISC, because this is when the cases of MISC go up. So that is something else that impacts children in this age group. And then lastly, this is a serious thing in kids, because what we are also starting to see is the long haul COVID. And you may have heard of this. This is when folks, don't just like get better after a couple of days, but their symptoms persist. They have things like fatigue and that mental fog and rashes, and ongoing heart and cardiac issues, all these things that don't go away. We're seeing it in adults, and now we're also seeing it in children. And these kids are going to have to be followed for a long time. We're going to have to follow them as physicians for a long time to make sure that they recover and don't have some permanent disability from having COVID infection. So that's what I tell families first. I say COVID is a serious thing in kids. Kids can get sick. Kids can die from COVID, and they can have long-term, consequences from COVID. And then the second thing I talk about is the vaccine. The vaccine is safe and effective. Trials have been done, especially this Pfizer vaccine was studied. Over 2,000 people were in the clinical trial. It was found to be safe, no kind of adverse effects beyond what the adults have shown, like arm pain and some fatigue and maybe some chills that all go away. And it was also shown to be effective. It was 100% effective. 0 children who got the vaccine got COVID. And in addition, it was actually found to be more effective in this age group than in the older teen age group. So this age group, the kids actually had higher antibody titers. So their immune system fought the virus even stronger than kids in the older age group. So it was proven to be safe and effective. Thus, the FDA approved it, and then another CDC panel approved it. So I talk about why COVID is bad. I talk about its safety and the efficacy of the vaccine. And what I have been doing for years as a pediatrician, especially to convince vaccine hesitant parents, is I trust this vaccine and vaccines in general so much that I also my kids have gotten this vaccine. So a couple weeks ago, or was it last week? The time is a blur. My kids also got this vaccine. So I have a 12-year-old, I have a 15-year-old. They've never asked for a vaccine before. They've never asked for a shot before, but they were ready, first in line, to get this vaccine because our children have lost so much this year. the pandemic has impacted their mental health, socio-emotional interactions, economic, their education, it's impacted them so much. And they know that this vaccine is the way out. This is how we get back to normal. So that's the last thing I often share with my parents. I trust this so much that my own children have also gotten this vaccine.
Thank you, Dr. Mona. You got all that great information, your personal experience. And so I'm going to tip across here to Dr. Reynolds, because Dr. Reynolds is, I call him a historian and a pediatrician, and he's had information about the historical use of vaccines and that experience. And so, the one question too was, this is a quick, I said, this was a really seemingly quickly developed vaccine. So what do you say, Dr. Reynolds, based upon your experience in history?
Well, it may appear quick because it was built on the foundation of so many other vaccines and vaccine development. And thank God for that, because you have to understand, I'm probably the oldest person on this panel. I was born during the polio outbreaks in New York. When I was an intern, before there was Haemophilus influenza vaccine, if I did a spinal tap on a child who I thought was sick, instead of the spinal fluid coming out like clear water, it came out like pus, yellow, thick fluid. And when you see that as a pediatrician, you have to calm yourself down, because we know that there will be damage thereafter. And I came around at the time when everybody got measles, mumps, rubella, and chickenpox. But people did not see the things that happened after those conditions. So that could be problems with sterility, brain damage, all sorts of things that would follow and I have to put it this way, most parents in their 20s and 50s have never seen. So they say, well, why are you getting so worked up about this? And if I may paraphrase a rapper who said, I got 99 problems, and a vaccine preventable disease should not be one, because you don't want to wish this even on your worst enemy. Mm-hmm. So yes, in the past, and back when I was in medical school, when the swine flu vaccine came out, there were things that had to be addressed. There were some problems. However, over that course, 1975 until now, they have been addressed. We have the vaccine adverse event reporting system. You can go to any website. It's on all the handouts. You wonder, why does my pediatrician always give me all these handouts after an immunization? Because that information is there. So, and it doesn't have to be something serious. If you think it's an adverse reaction, you report it and they will get back to you. So that's all the system stuff that was set up. And then as Dr. Mona outlined, there's a whole process for producing a vaccine. And, now sometimes it can be just like turning out a new model car. Sometimes it's the same frame. Sometimes it's the same engine, but the body is different. And, maybe there are a few other things thrown in that you specifically want. And in our case, you specifically need. So this is the process. We don't say, I'm not going to get on the latest jet that was produced because it's new. We don't say, I'm not going to get the newest car I can get because it's new. Because we realize it was built on years of experience, and there's a process with quality checks. Did I answer your question for you?
Well, yes, sir, Dr. Reynolds, and you gave me a little bit more, but you gave me a good a segue over to Dr. Wolford, because both you and Dr. Mona talked about the impact of the disease on children, which we may not think about as a long-term implication without the vaccine. Now, this is all about people making informed decisions, right? Parents have to make these decisions for their children. So Dr. Wolford, you're working in a hospital setting. What are some of the things that you're seeing, and what do you say?
So I agree with everything that has been said. I think Dr. Mona gave us the 3 points that need to be made. And I love that example about the cars and how they're produced, because that is exactly how we need to think about this. And when I speak to parents, I emphasize those things as well, along with the fact that, many of us had hesitation. In the very beginning, before the vaccine was available, when asked whether I would get it, I said no. And I support vaccines wholeheartedly. But there was a lot going on. There were all the questions about the politics. There were all the questions about the speed, because we didn't know, many of us, that this had been developed over many, many years, and that it had been used in the technology had been used in many ways previously. But so we had questions. But then as we learned more and more about it, we moved from a no to a maybe to a yes, please give it to me now. So I want to share with them that this is a transition, it is a process, and that they should just keep getting as much information as they need to make the best choice for their child. And some of the information, because people keep saying, I need more time, we need to see this for a longer period of time. And what I like to emphasize is the fact that when vaccines have difficulties, they show up very soon after they're administered. You do not find problems with vaccines in general decades down the road. You find those problems out within the first few weeks to couple of months. So what you want to know is, have a lot of people gotten the vaccine, not just 2 or 3, have a lot of people gotten the vaccine and have a few months passed, that will give you the information. And in this case, we have millions of people who've had the vaccine, and we've had several months to see it. And we see that it is incredibly safe and incredibly effective. So that should give us a lot of reassurance that if we want to protect children, this is one of the best ways you can protect them.
Thank you, Dr. Wolford. And I see both heads nodding on Dr. Reynolds and Dr. Mona. I want to just bring Dr. Hackert in for a minute, because not only is she the health officer, she's actually a medical doctor. And so Dr. Hackert, in the work that you're doing, some of the questions are, who's eligible? What children are eligible? And what's the vaccine? And where and how can they access it?
Sure, I'm happy to talk about that. So it is, 12 and up are eligible. They are looking and expecting probably to go down to as young as age 2 by the end of summer, which will be amazing. And anywhere that is doing Pfizer vaccines, that's the only vaccine currently authorized by the FDA for use in the adolescents under 18. And our Curative Lab site has that every single day. They have special hours also for the 12 to 15-year-olds. And basically, if you can get it, you should. I have a few other maybe a little bit different aspect of things to talk about with regard to why children should be getting this. Would it be possible for me to share my screen just for a moment? I think it's easier than not, and just trying to use these words.
Okay, we'll have the tech team give us that answer. Can you?
Let's see. I believe I can.
Yep, no problem.
And are you seeing my screen at all?
That's easy. I got COVID at summer camp and I'm still not the same. Okay.
Right. So I think it's just from Texas in February, or January. I think it's a really nice summary of a couple of points that are more of a tangent to the whole facts of the safety of vaccine, but also really important for families who are having thoughtful conversations about whether or not to get their children vaccinated, things that may come into play in the balancing of whether or not you want to do it right now. And there is, as I think each of the doctors have said, long COVID syndrome in children, just as there are in adults. And the most common long-term things that happen with children are cardiac, neurological, respiratory, and deconditioning, and then also the psychological aspects of it. And so this is a soccer player who said that an elite player, usually in top condition, she couldn't run as fast, her stamina wasn't the same. Also around 6 to 9 months, some of the teenagers are losing their hair. not a happy thing at all. But I also wanted to talk about this. So it's talking about the dual pandemic, pediatric mental health. And we know that this is a huge issue. Suicide, ideation in children, especially teens, because of the isolation they've had to go through the last year and a half is huge. And so by getting children vaccinated, you're actually taking a very positive step towards reducing your child and all children in our community, their risk of this interrupted adolescence. And it shows a bit of, these are like the higher rates, and it is very high, the suicide ideation and attempts before and after COVID. I mean, this is like March, and here you're seeing like going back up again. And so it really does have this, not only does it have the neurological problems that your child may not be able to function. I can stop sharing now. Back to this. I always seem to struggle with getting it back onto the regular, like not sharing anymore. Where is it? Am I still sharing or not?
We think we see your screen that has I'm not sure, it looks like almost a rock, a mountain.
Yeah.
So you should be able to hit the stop sharing at the top of your screen.
Yeah, I don't actually have that. Oh, here's I have a few screens. So, sorry.
There we go. There we go.
Sorry about that. Honestly, after 10 times, you'd think I would not do that. But that is a very significant issue, and you don't know who it's going to happen to. But the fatigue that I have seen. So when I was at Henry Ford, I was treating patients up until December 30th at Henry Ford, and even though I was treating adult patients, I did treat quite a few 18 to 22-year-olds, some of whom were correction officers in the prisons. And so they had it very early. And I was seeing 18-year-olds, 21-year-olds who had totally recovered in terms of communicability. Even at that early time, we knew they were no longer contagious. And that was when we didn't know it was as short as it was. But months later, they could not even, golf. They were like 5 miles a day runners. They couldn't golf with a cart. They had no stamina at all. And I would, take them for walks on the stairs, and their oxygen was okay, like 95, which is pretty low for a healthy young adult. And then by the time they did 2 flights, it was like 90. So they could not breathe. And this was 6 months down the road. It's something that we can avoid by getting vaccine. The vaccines we know are perfectly safe. It's 100% effective in the trials that they've done. Nobody was getting COVID in this age group. So they're responding even better than the adults.
Thank you, Dr. Hacker. I mean, this is really incredible information. We could probably talk the whole hour about this, but there's one question in the queue I'd like to have you all answer, and that is, can someone explain why it's taking so long to get approval for the ages 2 to 15 or 2 to 6? Yeah. Do we know?
I can answer that live.
Yes, please.
It's just the way they do the drug testing, because they want to always protect the pregnant women and children. And so they start with adults. And then as that safety data comes in, they build on that. And so they build on that as expanding the ages that are approved. So with Pfizer being approved from the beginning with age 16 and up, it's because their first test included the 16 and up as adults, because many ways they had the bodies of adults by then. And so that's why we move it down. It's a safety factor in terms of making sure that there's nothing showing up in the adults that went first. It's sort of like lifeboats.
Thank you, Dr. Hacker. Now, this is an amazing roundtable. I'm going to give you, I know this is difficult for you, docs, because you talk to people all the time, parents and children, and you want to make sure everything is clear. But I'll give you 30 seconds for your closing comment. I want to start with you, Dr. Wolford. We'll go to Dr. Reynolds, and then we'll have our last remark from Dr. Mona.
My 30 seconds.
30 seconds.
Speak to your child's pediatrician. Go with your questions. Keep going until you get them answered. and then speak to somebody you know who's given the vaccine to their child. It always helps to hear from somebody you know and trust. And keep
Thank you.
coming to this webinar where we'll keep answering your questions if you can't find the answers elsewhere.
Thank you. Dr. Lawrence Reynolds. I think you're on mute.
I am unmuted now.
Yes.
Now, about 16 months ago, only 2.4% of the cases were in children. And I'm reading this off the American Academy of Pediatrics report. Now, as of May 13th, 2021, 24% of the cases were child cases. So please get your child immunized. And what I recommend is when you go to get vaccinated, take everybody 12 and over with you. And then make sure you have a provider, nurse practitioner, family practitioner, pediatrician, but make sure you have one of record. So when it becomes available for children under 12, you have someone to talk to or who can direct you to someone you can talk to. And as Dr. Verholden always said, you have to have a plan. And that's part of your plan. Get a medical home, and you can call the health department also.
Thank you, Dr. Lawrence Reynolds. Dr. Mona Hana-Atisha, what's the last word? 30 seconds, can you do it?
Quick story. My daughter had a soccer game Wednesday evening. They've never won one game. And one of her teammates left in the middle of the game for 15 minutes. She left to get her shot. She came back after her shot and she scored a goal. So this shot is amazing for this age group. It will make you win in many ways.
Thank you to all the doctors. Now, Dr. Hackett, I'm going to ask you to come back if you can stay with us because we've got a segment for the health department. There's some questions we'd like you to respond to. But I want to thank all of you on our panel today. Great information that you shared. And stay tuned, everybody. There's more to come. We have some additional information in the coming weeks about this topic because we didn't get a lot of time to talk about boosters, but that's up too. So thank you to our panel. We need to run quickly over to Gary Jones before he has to leave us today to give us updates out of the governor's office. Gary Jones.
All right, thank you, Yvonne, and good afternoon, everyone. So Governor Whitmer yesterday announced a bipartisan agreement with Senate Majority Leader Mike Shirkey and Speaker of the House, Jason Wentworth. Republicans have agreed to fully negotiate the state budget and federal funding from the CARES Act and the American Rescue Act with the state budget director. The governor has agreed to withdraw the Michigan Occupational Safety and Health Administration's proposed permanent rules and to have a conversation about formalizing legislative input on epidemic orders. As the focus now shifts to working on the state budget, and with the large boost in state revenues to be announced today at the Consensus Revenue Estimating Conference, Michigan is in a very strong position to make large investments that can transform the state and help our residents and businesses recover from the pandemic. With more than $2 billion remaining in CARES Act funding, nearly $20 billion in funding from the American Rescue Plan, and now a large influx of additional state revenue, this is a moment in Michigan's history that can deliver real and lasting positive outcomes for the state. And lastly, due to the governor's leadership, we have been able to continue to take significant steps in our fight to eradicate COVID and energize the economy. After the CDC's new mask guidance, we had to make some quick changes to current plans. So the original Back to Normal plan had 4 steps. On May 10th, as you remember, we hit our first step, getting 55% of Michigan vaccinated with 1 shot of the safe and effective COVID vaccine, meaning that 2 weeks after hitting that milestone, in-person work would be allowed to resume for all workers. We expect MIOSHA to take action to allow this to happen, with more information coming on Monday. But based on the new CDC mask guidance, we will be revising the Back to Normal plan to outline 2 additional steps to get Michigan back to normal. On June 1st, all outdoor capacity limits will be lifted. Indoor social gatherings such as weddings, funerals, and conferences will be allowed to resume at 50% capacity through the month of June. Also in June, people who are not yet fully vaccinated will still be required to mask up indoors. MDHHS will officially release the updated order on Monday. And the last thing I should say, on July 1st, our final step will lift the broad mask and gathering order for Michiganders at both indoors and outdoor gatherings. We will still have orders in place pertaining to specific higher risk environments and reserve the right to issue guidance to keep vulnerable populations safe from COVID-19 and its variants. But for the most part, life will be back to normal and we can have a better Independence Day, let's say, than last year, one that, hopefully will be more memorable. And so finally, I always like to plug the resources, michigan.gov/COVID vaccine and michigan.gov/coronavirus, still the best catch-all websites.
Thank you, Gary. And now we've heard it directly from the governor's office through Gary Jones, who is the community affairs representative for Flint. Thank you so much, Gary. I know you got a lot of things going on, but we appreciate you taking your time each week to come and share with us. Now, what that back to normal means, we've got to work on it. And some of the questions we have are about things that happen right here in the city of Flint. So we're also glad to welcome today Lottie Ferguson, who's the Chief Resilience Officer for the City of Flint out of the Mayor's office. She wants you to know that she's available to answer any questions that you might have, as we can, in the background here today, and she'll come on at a future webinar to talk to us specifically. But thank you, Lottie, for joining us, and we'll look forward to hearing from you. And we'd like to ask our listeners again, please put some questions in the queue. She will be happy to answer them for you. This segment we're going to go to next is back with the health department. And I want to ask Dr. Hacker if she would come back. Sherelle Brown is also with us. I understand Sherelle is out at one of our sites today where vaccinations are being given. So Dr. Hacker, and I know we just had a few minutes earlier, but you've done a lot of work in our community to make sure that we have all these vaccine sites available. Can you talk a little bit about that to us, and then share the other thoughts that you had that we couldn't get all in the round table?
Oh, that's a lot. So we are continuing our sites. We are kind of almost scaling down a little bit so that we can expand. If that makes sense. We are making somewhat smaller hours, but trying to be in more places that we have never been able to be before. And with that in mind, we also have the longer hours, though, every day except Monday at the 4100 Saginaw. It's the Curative Labs partnership that we're doing, and that is the Diplomat Pharmacy building. So you can either walk in there at any time or go on our website, gchd.us, and book an appointment. So whichever one you want, there really has not been a wait at all. They are also coming out into the community now, and I know they have some plans to be present during the Juneteenth festivals to vaccinate in the on-site there. And then what were your other questions? I forgot.
So can you talk a little bit about some of the work that you've done? I know we've got Curative here,
right.
And you mentioned that address, but this is so that we can have some ongoing opportunities, and then the health department can do all the other things that the health department is supposed to be doing for us.
True, because we have been doing more. We've been going into some of the public housing authority areas. We have continued our three, just absolutely close partners with Central Church of the Nazarene, Shiloh Missionary Baptist Church, and Our Lady of Guadalupe, and working on those. We are starting the Flint Farmers Market outreach, and the opportunities are really available. I will tell you something that is going on behind the scenes right now, because the Governor's Protect Michigan initiative came to Flint starting this week, and the flyers that they're giving out it's super convenient, and you put in a text, your zip code in a text, and you get back where you can get the vaccines in the community. The biggest thing, and this is a mistake on my part, is that we did not have Curative Labs sign up with the link to that. So they are there, despite the fact that if you go onto the link that they provide you in those flyers, it'll take you to vaccine availability, and you put in your zip code. Curative at Diplomat Pharmacy building is not showing up, but it is there all the time, 10 to 8 every single day, 4100 Saginaw. except Monday. So all day Sunday, all day Saturday. And we are trying to correct that as we speak. And we will hopefully get that in there soon. But when you see those flyers, and it's a super convenient link, you will not see the curative lab sites.
All right, thank you. Now we just want to go back a minute. Sherelle, she's out actually at MTA right now. And so Sherelle, if you can just, I know it's a little bit loud where you are, but we just want you to come off and just tell us what's it like out there actually at MTA with a vaccine event.
Yes, so I was able to secure a quieter room. It's been pleasant to see people interested and being able to have all of their questions answered right here live and in person. And we've gotten a few people to get vaccinated. They've been able to ask questions on the differences of the vaccine, which one is more effective, and, you know, just get that comfort that it's safe to get the vaccine, and we're here from you. We're here for you. So they're here, they're getting it, and it's good to be able to help and bring it to them instead of them trying to find us.
Yeah. Sherelle, I want to thank you because I know it's a lot of work. You know, you get up to get your daughter to school, and then you're out at these community events, making sure that you're a face that people can actually talk to, and that does make a difference.
Yes, thank you.
Sherelle is the best.
So just let's focus a little bit. Right now today, we know that Sherelle is out at MTA, but there's also first and second dose vaccines available for the Moderna vaccine and for the Pfizer first dose for young people 12 and up at Our Lady of Guadalupe. They'll be there till 4 o'clock today. Sherelle, you want to talk about some of the other events that are going on this weekend and for the rest of the week or early next week?
Yes, so as you can see today, we are at MTA as well as Our Lady of Guadalupe, and we're also doing vaccines at the South Flint Soup Kitchen as well. We have Moderna available and Johnson & Johnson there and at MTA. Tomorrow, we're going to be at Flint Northwestern High School. That'll be from 9 a.m. to 1 p.m., in which we'll be giving first and second dose Pfizer. So bring the kids. Pfizer is eligible for 12 and older, so we hope to see as many as we can out there on Saturday. And upcoming next week, we'll continue with our efforts on Tuesday at St. Paul Episcopal Church Soup Kitchen.
Episcopal, yeah.
Yes. And then we'll also be starting our first clinic at the Flint Farmers Market on Tuesday. So that gives a centralized location for people to come and get vaccinated. We'll have Johnson & Johnson available as well as Pfizer again. So we're hoping to see more children out at these events getting vaccinated and those adults who have yet to become vaccinated. Wednesday will be at Central Church of Nazarene. We're there mostly every Wednesday. And there you can get a first dose of Pfizer as well as Johnson & Johnson. Thursday, we have our Shiloh Missionary Baptist Church located on the north end of Flint, where we're giving first and second doses of Moderna. Again, all of these appointments are walk-in, so you don't have to worry about appointment. We'll be back at the Farmers Market as well on Thursday, giving Pfizer and Johnson & Johnson from 10 to 2. So whichever location is best for you to make it to, we ask that you come on out. And Friday, we'll be back at Our Lady of Guadalupe from 8 a.m. to 11 a.m. giving second dose Moderna. Anyone who's missed second dose Pfizer, you're welcome to visit Diplomat Pharmacy. As you heard earlier, we are in partnership with Curative, and we're giving the opportunity for second dose Pfizer who might have missed it to go there Tuesday through Sunday. They're available from 10 a.m. to 8 p.m. So if you work late, that's the place you want to go.
Thank you. And Sherelle, people can always contact or schedule their appointment if they need to, but they can always do these walk-ins. And so we appreciate the work that you're doing. And today is a good day. We're talking about both mental health and we're talking about Pfizer, about the vaccines. So with you being out in community and some other health representatives being in community, if they have questions, they can get those questions answered even during this experience at one of these sites. So thank you so much, Sherelle. We appreciate you.
I also wanted to bring in with MTA and the rides for wellness, which we have been doing, but they had been more by appointment. So now you only have to call MTA, say you'd like a ride to a vaccine clinic, any of these clinics, any location, and they will pick you up, wait with you, and bring you home free.
Thank you so much. Thank you, Dr. Hackert, and thank you, Sherelle. We appreciate all the hard work that the health department is doing to make sure, and I always use this term, to assure our health. That means you got to be out there making sure where people are, you are as well. And to all the community members who speak their voice, this is really critically important because it's your voice and it helps guide the work that's being done. So thank you. Now, we every week try to bring you for the last, I think it's about 26 or 27 weeks now, an update on some really important equity conversation pieces. And so Dr. Deborah Verholden, who sits on the Michigan Coronavirus Task Force on racial disparities and the Greater Flint Corona Task Force on racial disparities, she's in New York, she's all over the place. Dr. Deborah, I don't know how we gonna keep up with you, but we appreciate you being here in our community because you're an advocate for equity, making sure that everybody has the opportunity for the resources and services that should be available, and it should not be limited to whether or not we live in certain areas. So Dr. Deborah, give us the updates for us this week.
Okay, great. So I want to first give a little highlight to something, and I'm sorry I'm not bringing it sooner, but I'm going to keep bringing it forward. You know, we've realized the importance of public health, I think, during this pandemic, and I want the community to know that MSU is very vested in increasing the number of public health prepared professionals. That's a mouthful. Public health prepared professionals that we have in the city of Flint. And we do have a Flint Spartan Master of Public Health Scholarship. A lot of the other universities were too hoity-toity to do online learning and online training for MPH programs. We were not. We have had a fully, it's called asynchronous online program. Asynchronous means the whole course is bundled together and you can do it at your own pace. You do have to complete it within the semester, but it's a great program for people who are working or for people who are managing children or other life responsibilities who are really interested in getting good public health training. The Flint Scholarship is for anybody that lives or works in the Flint community. So that's the greater Flint community. Of course, we want people in the city of Flint, but it's anybody in our Flint community. So you could be in Genesee County, living or working and serving this area, and you are eligible. You have to apply for the program. The program application deadline for this year for the scholarship is May 31st. And then you apply separately for the scholarship. It comes with full tuition. So I'm telling you, this is the free MPH Go Green for anybody that's interested in getting some public health training. We do have rolling admissions. So if you miss that May 31st deadline, don't worry about it. You can actually enter our program at any point during the year. And I will make sure I do a better job of elevating this and making sure that it's on people's radars earlier. But please do let your friends know. The link is up in the chat to click on it to find out more about the program. I also want to point people to, we have a free COVID course, a course for people to understand all things COVID, and they're adding now a module on COVID vaccines. That course is freely available. When you complete the course, you'll get a certificate. We've paid to have up to, I think it's 2,500 residents and people in community can take that course for free. And again, you can do it at your own pace. So you want to be able to do some of the stuff we're doing and talk about it, here's an access in. Now, let me tell you about what's happening in the city of Flint and in Genesee County. Cases have declined for the 4th consecutive week, down 60% last week in the county, down 63% in the city of Flint. And our testing positivity rate, that means of the people who are going to get tested. And remember, the city of Flint and the health department and many of our partners, the state, have made sure that testing has remained readily available in the community, and rapid testing is readily available in the community. And Sherelle told us about some of those sites. So the percentage of people who are testing positive is going down also. It decreased from 10% to 7%. And as you all know, we're still, chugging along with these vaccine rates, and 35% of our population 16 and over are fully vaccinated, and 46% have received at least one dose of a 2-dose vaccine. This is what it looks like. We're doing a better job at getting that race data in. Remember, we had these tremendous disparities when the pandemic started. African Americans specifically got hit really hard by the pandemic in Flint and Genesee County. It's very important that we continue to collect that race data that the providers collected. When you go get tested, make sure that you check that, box, because we want to make sure that everybody in the community is safe and that certain communities aren't being harder hit. So to that end, we've got to keep collecting that data. But the numbers are going down in the city and in the county. And with the data that we have, it looks like we've kept that racial disparities gap closed, both in the county and in the city. I'm going to now hand it over to my partner and the brainchild behind this health equity brief, our very own public health policy specialist, Mary Catherine Crawford.
Thanks, Doc. So if anyone has any questions about what's being reported, just shoot me an email, crawf457@msu.edu. But I actually kind of just want to go right into recommendations about and go speak off of what you just mentioned, which is this need to collect data. And it's actually the perfect segue, because one of the first things I wanted to talk about this week is reevaluating the Michigan Care Improvement Registry, also known as MICR, so that we can actually collect the data that you're speaking to effortlessly. And with the magnitude of funding opportunities that you heard Gary talk about that we now have, we really need to invest in our health technology infrastructure. And so policymakers have an opportunity to work with practitioners and health systems to make major improvements in capacity that ensures this collection. Including the vaccination histories for children and adults. We need to ensure that those are complete within these systems with participation from all providers of our vaccines, including pharmacists, right? Because it's not just, your pediatrician or primary care physician that you could go to. And we want to ensure that that information is recorded no matter where it comes from. And the second part of this is that we need data sharing policies that then allow for cross-state or other kinds of sharing agreements between health information exchanges. And this will address so many of the issues that we've been facing with regarding the missing data and rates of collection and exchange. The second thing I want to talk about is the need for our legislators to lead by example, continue to work closely with trusted, credible messengers, and share information with good channels like leaders from the community to keep building vaccine confidence. And lastly, mandate equity. I want to talk about how our need to get that American Families Plan Act passed. This will help funnel major investments into childhood health equity, expanding these important tax credits that will provide relief from costly insurance premiums and actually enable 4 million additional people to gain insurance coverage, in addition to lifting children out of poverty. So this is really, really important legislation that we need our policymakers to support.
So Mary Catherine, thank you so much. And Dr. Deborah, but I have a quick question for you. These recommendations for policymakers, what are really important? What can we do as citizens to help move this? Do we take these and have conversation with our council people, to our state representatives? What do you recommend we do with this information?
Definitely call your representatives. That's also information I'm so happy to share if people have questions. You can find it with a quick Google search, but contacting the Flint delegation or the Genesee County delegation, your commissioners, our U.S. senators, our state reps, contact them, express your concerns, your support, get your questions answered. Right? These are all ways that we can take action as citizens, and of course, voting.
Yeah.
And I would encourage people to think about strength in numbers also. So if you are part of a professional society, you're a social worker and you're a part of a social worker organization, or if you're a public health person and you have a local public health chapter, or your church or your community association, there's also strength in numbers. You can also write these folks and let them know that these are the things that we want to see. So also realize you have these affinity groups, we call them, groups that you're naturally coordinated with. Again, whether it be a church or a community association or a professional society, there's also some strength in numbers. Get these things documented. Write these folks, send them letters, send them emails, call them, and let them know that these are things that are important to you. And like Mary Catherine said, then there's always the chance to cast your voice by casting your vote. We've got a lot of stuff right now, and our money is held up in the legislature. We need our legislators to know we don't want all of the, political muckety muck getting in the way of us getting resources and good public health services widely available in community.
Now, Dr. Deborah, I talk to you a lot about all of the social media stuff, and you do these hashtags, and you got a hashtag mandate equity. Now, for those of us who are not all that tech savvy, tell us what that means and how do we utilize that?
So when you write about some of these things, if you say, I want to make sure that, we've got good data to be able to answer some of these questions, you put the hashtag mandate equity at the end of your post, and then it starts to trend. So if somebody searches for the hashtag mandate equity, they can see all of the types of conversations that people are having around that movement. So the use of hashtags, like we talked about with the Get Vax online day that's happening today, we ask people to use the hashtag because it's a way in that virtual space of being able to pool all of those conversations. So anybody can search for the hashtag and see the types of things that people are using and talking about in relationship to that particular hashtag. So I do encourage people, hashtag mandate equity.
So it's another form of data collection, because I know you really like that. So I want to ask one more question. Number one is talking about MICR, and there was a question in the queue about getting individuals' information in these registries if they're needing to. So I don't know, Dr. Hackert may come back here and join us. But what is the health department? How is the health department helping us ensure that individuals' information is being put into this registry?
So that is actually mandated that it should be in there in 24 hours, and it is not always. We're meeting that goal, but I think some of the pharmacies, the national chains are struggling to meet that. And so I have not actually been, I haven't been able to address that issue.
So the reason I ask that is because if we go to all these other places to get our vaccines, this is another place that our voices can be important, and ask them, did you put my information in the registry? And so that may be another way we can encourage that. Dr. Deb, did you have another thought on that?
Yeah, because this is a policy issue. So Dr. Hackert raises an important point, which we have a lot of laws on the books and a lot of things that have been written that are not being enforced. So mandate equity is also about enforcement of the laws that we have. Dr. Hackert has an impossible lift on her shoulders. And the whole point with mandate equity is that we get some legislative pull for all of the community push that we're trying to do to ensure that everybody gets their needs met, right? So if we've got a law that says, if you vaccinate somebody outside of your state, you have to share that information in the county or in the state where that person comes from, but that law is not being enforced. Dr. Hackert in the local health department have, almost no capacity to then solve that. So it's akin to gums without teeth. That's what laws without enforcement are. They're like gums without teeth. They have no bite because there's no compliance checks and no penalty if people don't do it.
Yeah. So this is where we as residents can keep, as we wrap up here today, but this is where we as residents can really be helpful in making sure that our voices are heard in moving some of these ideas forward. So thank you so much for sharing that. And Dr. Hackert, please come back next time. I know you've got more, and all of our panelists, we're going to invite you to come back and be with us next week. We like all of you, please, as you're hashtagging, put the webinar into your social media and let folks know that we're here, particularly for those of you that are social workers and community health workers. A lot of work has been done to ensure that you can get continuing education units for social workers through MISHWA. You know that you need to go in here now, attend the webinar, and complete the registration so that you submit your completed registration so that you can get the continuing education unit. There's a place following the webinar that you can select your occupation, whether you're a community health worker or social worker, and they'll guide you through the process so you can see that you successfully submitted your survey to get those units that are important to you and your certification. We want to thank you for joining us today. We ask you to like us on Facebook again, and then subscribe to our YouTube channel, Healthy Flint. Please feel free to email us at any time if you have questions at info@hfrcc.org. Call us at 810-835-2130. And believe me, we've got a good program set up for you next week. Don't miss. Our panelists will be right back here to answer questions for you as you join us next week, May 28th, for the Flint Community Webinar on coronavirus. We look forward to having this opportunity to share with you again. Thank you for joining us today. And again, enjoy your week and join us again next Friday.